we started to have more and more responsibilities in running our day-to-day operations that at the beginning didn't seem very overwhelming, but as you start to look back, we had so many different responsibilities of the business aspects, the contractual opportunities that we needed to pursue, maintaining all the different ancillary type of functions and services, that it just became overwhelming for us as physicians.
Oftentimes it has been, okay, we're doing fine. We may be getting paid more a little bit over time for the services we provide. I've got a team that I treat like a family, yet I feel like I'm losing kind of control of the reins, or it's sucking up so much of my time I can't see patients like I want to.
We're trained to be in medical practice, take care of patients and respond to their needs, yet at the same time we were pulled in a direction away from those responsibilities to the point where we were dedicating more and more time to the business aspects, and that's not our forte, that's not our strength. We needed the benefit, the knowledge, and the expertise of others who that is their area of focus, not ours. And I think it was a good decision to look to other people to help us develop our business in a better way and allow us to get back into the clinical responsibilities that is what we trained many years for. Other people train many years for business, so why not let them do what they do while we do what we do?
As a business partner, we manage the support services and we provide the operational oversight for that team. Part of our role is to, hey, how do we help a practice look at something that seems, it's a 20th century technology, how do we help them make that better so that team of 12 can actually address all of the patient questions and the inbound calls that we get and do that effectively.
I feel like we have so much less red tape. If a patient needs the other specialty, it's usually something as simple as a phone call. If it can't be done, simply as a click by reception on the computer.
I think the structure is a great workflow because there are times where I have to ask questions to colleagues and colleagues will ask me for questions. So it's really helpful to have an environment where we can work together. Being in separate silos is not good for continuity of care and for camaraderie.
We're able to then say, oh, okay, we can better use that staff time on the complicated patient questions instead of, hey, how do I transcribe voice to text into a system that's not really value added? And so I think to me, there are a lot of small examples of that's really practice transformation in a context where we know labor costs aren't going to go down. And it's not that we're here to reduce the number of people. We're here to give the team the right set of tools to be successful in the role that provides a great patient experience.
I have never had a problem when I've had a patient that needs to be seen by, say, gastroenterology because they're not doing great on their IBD management, and they were here to see me with a perianal complaint that we weren't able to work them in a timely manner. And that's that cutting through the red tape of, even though the schedule's full, we're able to find the time to take care of that patient because they've been seen by the surgeon, or conversely, they've been seen by the gastroenterologist, and they just need to be seen and taken care of by the other specialty.
Because we're a large enough group and we're supportive of each other, and we can self-refer to one another, we can support any part or sub-part of GI care that's out there or someone's interested in.
He said, we would love to be able to expand our reach. Why? Because we want to have the expertise of other gastrointestinal practices join us. We also want to be able to get the best out of how do you manage your practice, right? How do you have better financial management? How do you oversee the billing, meaning the revenue cycle better? So we saw that if we could have the services of multiple practices in one umbrella organization, that just strengthens us. Why? Because then we as physicians can concentrate on what? Taking care of patients. And then the administrative portions of it, right, are really strengthened by people who do that the best.
We've been very pleased that they've been able to take over the business aspects and able to enforce and strengthen the vision that we had, but at the same time, we were not able to take those visions forward. They were able to, have been able to do that, and I think looking at our future, we're excited that they'll be able to continue on in a direction and beyond where we thought we could ever be.